Okay, so there are, I think, one or two latecomers to arrive, but I'm Professor Stephen Harding from the University of Nottingham, and I'm chairman of the Royal Society of Chemistry Felix Biotechnology Medal Awards Committee, and so myself and distinguished colleagues from Zhejiang University, Vice President Zhan Gu and Professor Gao, who's Vice Dean of the College of Pharmaceutical Sciences, would like to welcome you to this happy occasion, and it is a very happy occasion, of the award of the 2019 medal to our colleague Professor Zhen Gu. And for the benefit of those people who are tuning in online, on the chat box I've put a agenda or program of events. Now, already we're starting a bit late, that's okay. So it is only a guideline of how we're going to run. So you should be able to see an agenda if you scroll up on the program. So
Stephen, can you tell us where that is, please? The where I can't see that in the.
Okay, so for those looking at some of the teams, if you look at the top of your Teams panel, you'll see some icons, and next to that there's like a chat symbol. So if you click that, you'll be able to see the program, Suzanne.
I don't think it has it on ours. I haven't got it on there.
Says it's only available to team members.
But I should be a team member. I'm a team member, but it should be there.
Should be, yeah, there should be an icon with at the top of the screen. There should be some icons. Can you see a hand?
Yeah.
Yes.
Next to the hand on the left, there's like a square with a.
Yeah.
Click that.
Yeah, that's blanked out for a non-team member. So the hand raised.
I can't get in there, no.
Raise a hand, but I can't do that.
Right.
Only the hand.
Yeah, so the hand works as Francis is showing the hand operating.
Yeah.
So can anybody see the chat?
No. Yeah, but you can't get into it. Never mind.
Okay, never mind. We'll cross that. But I'll show you the program in a minute when we do the formal intro. But what we're doing now is just introducing everybody. So I'm going to just introduce, if you like, people from outside China, and basically what we've got is we've got colleagues from the Royal Society of Chemistry who are joining us, and also colleagues from the University of Nottingham, where Professor Franks was an external lecturer for many years, and indeed was very popular with our students. So it's good to see some of our students joining us, and also joining us, I'm very proud to say, are members of Felix's family, including Suzanne and Caroline. And in fact, Suzanne's going to say a few words at the end of the proceedings. So before we show, if you like, the agenda on the screen, I'd like to hand over to my colleague Professor Gao, who's going to make some introductions from the Zhejiang University. So Professor Gao, can I hand over to you?
Okay. Thank you. Good afternoon, Dr. Harding and everyone. And here, good evening, Dr. Zhou and Dr. Gu, and hello everyone. So this is Zhejiang Gu. I'm the Vice Dean of Research from College of Pharmaceutical Sciences, Zhejiang University. And I'm so excited to attend this Royal Society of Chemistry Felix Medal Award ceremony. So now please allow me to introduce the distinguished professors who attend this ceremony on our side. So the first, Dr. Tianhua Zhou, the Vice Chancellor of Zhejiang University. And then Dr. Zhen Gu. So he is the Dean of College of Pharmaceutical Science, Zhejiang University, and he is the winner of Royal Society of Chemistry Felix Medal. So, and all the faculties, members of high medication level from Dr. Gu's group. Yeah. Welcome all. So today, we are all here to witness the significant moment for Dr. Gu. Now, we'd like to invite Dr. Harding to give us the opening remarks, please.
Thank you, Professor Gao. Can you all hear me okay?
Yes.
Yeah. So, yeah, welcome from the United Kingdom. And on behalf of the Royal Society of Chemistry, it gives me great pleasure to welcome you to this happy occasion of the inaugural award of the Felix Biotechnology Medal, which recognizes great achievement of early career researchers in chemical biotechnology. And a special thanks to President Shen Huahu and also Professor Zhen Gu, who's Vice Dean of the College of Pharmaceutical Sciences, as you've just heard, at Zhejiang University, for kindly agreeing to this presentation of the award to the program of events, since we can't see this on the chat here. So this is where things come in. Great patience when things went wrong with these things. So let's hope it goes right. And if I click that, and can you read? Can you see that screen, folks? Okay. Hello, can you see that?
Yes, we can. Yes. It's a master.
Now, yeah.
Okay. So this is the approximate plan. So already we're running a bit late. That's okay, because it makes things a bit more informal. So after my opening remarks, which I'm saying now, we've got President saying some more remarks, and then also will be actually presenting the award to Ken, and then he will give a presentation which will last approximately 20 minutes. We have our closing remarks, and three of us will be presenting that. So that's the very simple agenda for today. So let's see if I can just yeah. Now Felix, about Felix. The award is in commemoration of Felix Franks, who was a highly distinguished former chairman of the Royal Society of Chemistry Biotechnology Group, and the award is a result of the generosity of the Franks family. So a little bit more about Felix before we concentrate on Ken Ku. as well as being chairman of the group, he took a post in the Department of Botany at the University of Cambridge and became. And Felix was an international authority on water, and oddly also the removal of water substances such as freeze drying, but also in the biotechnology of carbohydrates and polysaccharides, which, as Felix would say, were biological molecules to water. He was also a great teacher, and as I said, he was an external lecturer with us at Nottingham. And on the right, this is a nice picture of teaching our master's students. You can see Felix just there at the age of 89. This was in 2015, and sadly he died in 2016. So even at the age of 89, he was still teaching our students, and extremely a great. And whilst he was at Cambridge, he founded his own company, and one of his inventions, this is Pofra, and one of his inventions was Exubera for the precise control of insulin delivery. And this mix of academic excellence and great innovation mirrors exactly Professor Zhen Gu's work, who also marries this academic excellence with many papers in top journals like PNAS and a host of nature journals. Indeed, in 2019, he received the highly cited Researcher Award from the Web of Science, as well as being a great innovator with his own companies, Xenomics and Zen Capsule, for the precise delivery of therapeutics, including insulin, as we will find out when he gives his presentation. So I'm sure Professor Franks would very much approve of the award of this medal to Zhen Gu. So I'm now going to hand over to Professor Zhen Gu, who I'm sure will say some more words about our wonderful Royal Society of Chemistry medalists before awarding the medal. So if I can now hand over to President Hu, and he will now say a few more words. So if I come out of that. Yes, okay, so can I hand over to Professor Hu?
Congratulations.
Oh, sorry.
Thank you.
Thank you.
Thank you. Very appreciate it.
So, congratulations. Yeah. Can I ask? Can I ask all the online participants if you would also unmute your microphones, and also if you could switch your cameras on if you can. Irene, apologies. I know you can't mute your microphone because you've got problems, but if everybody else could unmute their microphones. Okay. And Khalil? So, yes, once again, congratulations Hen on the award of the Felix Franks Biotechnology Medal. Okay. Right. I've done a print screen, so we've also got a picture of us all here, which we can add to your picture taken. So, Professor, who would you like to introduce the presentation of Hen, or would you like me to introduce him?
Dear Professor Felix Franks Farmery, dear Professor Stu Harding, and all friends, we are so excited to witness this fabulous moment and celebrate Professor Zhen Gu's another important achievement. As the Vice Chancellor of Zhejiang University, we feel so proud to have Professor Gu, such an exceptional innovator in our institute. As Zhejiang University always promotes innovation and cares about training the next generation innovators with global vision and impact. We are also dynamically boosting interdisciplinary research and international cooperation, which are essentially important today. We firmly believe that only when people with different backgrounds from different countries work together, we would fight and eventually win in the battle of anti-COVID-19. We therefore greatly appreciate setting of this award, encouraging our scientists across the world apply chemical science for exploiting biotechnologies. Thank you so much, Professor Felix Franks family and all of the community members. Welcome to Hanzhou. You will love it. Thank you.
Thank you.
Dr. Gu, I believe you will have many words to share with us. So please share your happiness with teachers and the students.
Okay, yes, thank you so much. Dear Vice Chancellor Zhu, dear Professor Stu Harding, and all committee members, all friends, I would like to say many, many thanks for your passionate support and encouragement. It's my great honor to have the first medal of this award. I greatly appreciate my students, my family members, especially my wife. I can do nothing without your hard working and wisdom. Importantly, our innovations are always based on others' significant scientific contributions. Of course, including Dr. Frank's significant discovery and inventions, such as the development of new ways of freeze-drying vaccines and insulin, also like insulin delivery systems. So as a researcher in the field of the drug delivery, especially developing the new insulin delivery systems for people with diabetes, I feel quite lucky to have this medal, this award. I will put it on my desk forever to inspire myself to further work hard to bring new innovations to the reality, to really help people as soon as possible, as soon as I could. So thank you so much, and take good care. Thank you.
Okay, thank you. We also feel quite honored to have you here, work together and study together. And then Dr. Gu is a world-renowned scientist in the field of drug delivery and biomaterials. With so many achievements in research, we would like to have Dr. Gu to give an academic report on his latest research. So welcome, Dr. Gu.
So can you see the slides?
No, we can just see you.
Oh.
I think the camera needs moving around. We can just see you, Hen. Yeah. If someone could turn the camera so we can see the screen, that would be great.
Now can you see the slides?
No. Oh, hang on.
Yes, we can.
Yes.
Okay.
Fabulous.
First slide. Yeah, so thank you so much again. So today I would like to briefly introduce our work associated with the bioresponsible drug delivery. So our work supported by Sanofi and our own startup companies, including Zinc Capsule and Xenomics. So as you know that in our body, always associated with the specific diseases, specific organs, tissues, some like physiological signals or biomarkers could be different from this kind of normal conditions or most tissues or organs in terms of the absolute concentration or relative gradients. So then we can leverage such a difference to promote the release of drug at the right time, right places, sometimes with the relatively correct dose to enhance the treatment efficacy, also like potentially reduce the side effects. So for example, in the tumor microenvironment, it's a bit acidic. So then you can design some like acidic sensitive materials or formulations to encapsulate the drug inside, and then deliver such acidic sensitive formulations to the tumor microenvironment or even like a subcellular environment. So under such like acidic environments, the formulations can be easily degraded, dissociated, or like swelling or shrinking to promote the release of the drug to enhance the healing effects. And for diabetes treatment, the increased blood sugar level can be leveraged to promote the release of the insulin to quickly maintain the blood sugar level in a normal range. And also associated with the water side, the sugar side, you can also identify the different biological signals as a trigger to promote the release of the drug. And as the design of the formulations, we are very interested in bio-inspired or biomimetic design. So we can either directly apply such like live cells or like a virus inside our body as the drug delivery carriers. We can add the drug on the surface or inside of such particles, and especially to leverage their targeting capability as well as the cargo release behavior to promote the release of the drug. And for this side, we are very interested in applying the platelets as the carriers to deliver drug. And another side is like we can mimic the function of such biological particles and apply the synthetic materials to form some like micro nano formulations to promote the release of drug. And for that part, we are very interested in using the glucose responsible materials or formulations to engineer the smart insulin delivery systems to mimic the function of the beta cells to control release of insulin at the right time. So I will introduce that part first. And especially, actually the slide is a bit different. Okay, so for the live cell-based delivery, and we are interested, as I said, it's like using the platelets, and we can add the drug on the surface of platelets, and then infuse such drug loaded platelets to the body, so they can target it to the bleeding sites, like also inflammation site. So then, during the surgery, once people remove the primary tumor, and you can infuse such platelets with drug to the body, and then they can target it to the bleeding sites. And then after the surgery, the drug can be promoted to release from the platelets. So here's like we leverage the natural physiological property of the platelets. They can home to, or like to target it to the bleeding site to bring the drug there, and then to potentially inhibit the tumor recurrence as well as the metastasis after the surgery. And another case is like we can apply the fat cells like adipocytes as the carriers for drug delivery. We can load the drug inside the oil droplets of the adipocytes, the fat cells, and especially to leverage the metabolism pathway of the such fat cells in the tumor microenvironment, and can enhance the delivery efficiency of such anti-cancer drug toward the tumor cells. And recently, we applied the dead cells. That means we can make such dead cells from the cancer cells through this kind of liquid nitrogen incubation, and then we can quickly increase the temperature, like within, let's say, around like 37 centigrade, and to make such dead cells. But we can load the drug inside such dead cancer cells, and some like cancer-associated antigens still like on the membrane, and then we can deliver such like drug-loaded cells to the body, and they can especially also like target to the some like tumor sites, and meanwhile to perform the control release to enhance the killing effects. And the antigen still like associated with such particles, the dead cells, so potentially they can also serve as the cancer vaccination. And for the smart insulin delivery, a few years ago, we developed the smart insulin patch. We can load the glucose responsible formulation inside the microneedle array patch. And such a formulation actually can be responding to the high blood sugar level, especially once the blood sugar level goes high, the insulin can be promoted to release from such particles. And then, once blood sugar level becomes normal, less insulin can be released from the system, and potentially can alleviate the risk of the hypoglycemia. So to achieve the ideal treatment, we load such particles inside the microneedle array patch. And as you know, that's the length or the height of each microneedle is about 600 to 800 micrometer. And most nerve cells underneath our skin is like 1,000 micrometer or like 1 millimeter away from the surface of the skin. So that's why once you apply the microneedle array patch to the skin, they won't interact with the nerve cells that significantly. So that's why we put like a painless based treatment method. So potentially can enhance the people's quality of life, especially for people with diabetes. And we apply this kind of modem-based method. You easily make such like a polymeric microneedle array patch, very uniform structure with sufficient stiffness. And once I talk about the microneedle array patch, I always like to show you this picture. The selling point actually is not this guy, actually the second one. You can see he's like a bit nervous, right? So potentially with the microneedle array patch, you don't have to worry about you will be the second one waiting in the line like this. You can easily put down the patch to your belly, to your arm, and to welcome to the blood sugar level. And we test on the mice. This result is like 5 years ago, and we found that the blood sugar level of the mice with type 1 diabetes can quickly jump down from a high level to a normal range, like below 200 milligram per deciliter within like 20 minutes. And meanwhile, you can see they can still like maintain the blood sugar level in the normal range for a while, then gradually increase. Not like the patch with the native insulin, the blood sugar level quickly went down and quickly went up, because for the control group, the insulin can be released like every moment, right? So, and even to achieve this kind of range of the hypoglycemia. So we also tested this kind of study. One patch up, blood sugar level went down, and at this time point, we put the second patch. And for the smart insulin patch, they can still maintain the blood sugar level in a normal range for a while, then increase. But for the patch with the pure insulin there, the brush level can further go down even to achieve a very low level like a hypoglycemia, which is like quite risky. So also 5 years ago, we run a startup company called Xenomics, and we received the investment like 3 years ago, and allow us to test such patch on the large animal model like pigs. So we can also get the opportunity to further like optimize our materials, also formulations to further enhance the performance of our patch. Now it's like a quarter-sized smart insulin patch could effectively regulate the brush levels of 25 kilogram type 1 diabetic pigs in a normal range for up to 24 hours. So we are actually quite proud of this kind of results, because a few years ago, once we published a paper in the PS, we did receive some email from him or her, and one email said, "Hi, Professor Gu, now you can treat the mice with diabetes. The mice like 20 gram, right? But he or she said it's like for people usage, probably it's like far away, because average like weight like let's say 60 kilogram. So somehow you need to wear some like a microneedle jacket, right, with a very large size and push back and forth, and then to control the brush level. However, technology is like always going forward, and so this is our latest design, and we find a mixture of monomers, and which can make the insulin well dissolved in such mixture, and then we can pour such mixture to the mold. And you can see here four monomers, 2 monomers with this kind of amine group, like this kind of group, and it's like on the neutral pH, it's like quite a positive charge. So they can firmly interact with the insulin. So insulin can bind to the such matrix. And the one monomer is like glucose responsible, and originally it's like the let's say the neutral charge. And once brush level goes high, this will become like a negative charge. So then once brush level goes high, the affinity between the insulin and the microneedle array patch can be decreased. So insulin can be released from the system. And the remainder monomer is like with 2 double bonds. So that means can serve as a cross-linker to cross-link the matrix of such microneedle array patch. So now the whole matrix is like glucose responsible. So that means you can load sufficient insulin there to enhance the loading capacity. And meanwhile, if people feel like uncomfortable, you can stop the usage anytime. You can just remove the patch and to potentially, really to reduce the side effects. And the whole manufacturing process now is like also quite easier. So we test on the patch, 1 patch young, and after 2 feedings, the brush level increases. And for the control group, like 1 patch young, after 1 feeding, after like 5 hours, the brush level gradually increases. So you can see the difference, because here, without the glucose responsible control, the insulin can be released like anytime, and then can quickly, make the brush level went up. And we also can continuously apply the patch to the pigs, 1 patch young after 2 feedings, the second day to replace another new patch, so you can last a long time, like even like over 40 hours. Now in our company, we can continuously apply patch like for over 1 week, even like 10 days, can still like maintain the brush level in the normal range, and without the symptom of the hypoglycemia. So once you remove the patch, you can see the structure still there. So that means only insulin can be delivered in the body, because the microneedle is like cross-linked and with very limited side effects toward the skin. So we also perform the glucose tolerance test. Once the brush level becomes normal, and we inject a bolus of the glucose to the pig, and then you can see quickly there was a peak associated with the insulin level. And the second time, also with the same trend. However, the second time the insulin release insulin is like a bit, let's say the amount is smaller than the original one, the first one. And now we are still like trying to improve it. And 1, 2, 3 different pigs, they show the same trend. And later we thought about this could be a broad platform technology. So because you can load the different drugs with the formulations, and later they can respond to the different biomarkers associated with different diseases, and then to promote the release of drug locally to the skin. And meanwhile, they can also be delivered to the whole body through the lympho circulation system as well as the capillary system. So based on this, we further developed the smart glucagon patch, which can respond to the high insulin level as well as the low glucose level. And the glucagon can be released from the patch and to alleviate the risk of the hypoglycemia. We even like to make such like a hybrid patch, like you can say 3/4 of the patch can respond to the high blood sugar level to promote the release of the insulin, and 1/4 of the patch, one corner is like which can respond to the low blood sugar level to release the glucagon to alleviate the hypoglycemia. And we can also make the Smarty cell patch to combine the live cells with the microneedle patch for the different applications. Heparin patch, which can respond to the thrombin level associated with the risk of the stroke. And the heparin, the blood thinner, can be released and to reduce the risk of the stroke, for example. Anti-acne patch, we can change the structure of the patch to make it like around the swab, and they can easily destroy the pimple, acne, and meanwhile can release some drugs there to enhance the treatment efficacy. So run a startup company called W Skin. The W actually looks like 2 microneedles. And later on, we also apply the patch for promoting hair growth or reducing the love handle, so for different applications. So here is the patch actually made from the protein from the hair, and you can see here they can effectively promote the hair growth associated with the mice. And we can also apply some like minimally invasive surgery to put the patch to the heart, and they can also perform the local delivery of the drug to treat the myocardial infarction. Then to the leaves of the plants, and here's like we can run this kind of sampling and to quickly do the detection of the like let's say the plant diseases. Okay, then you can run this kind of PCR very easy. And we can also put this kind of immunotherapeutic drugs into the microneedle patch to deliver the drug locally or systemically, as I said, through the capillary system and to the whole body. And you can enhance the treatment efficacy, and meanwhile to potentially reduce the dosage of the whole body to alleviate the side effects. And we also even make this kind of whole structured microneedle patch to guide the cold atmospheric plasma to the tumor sites. And the plasma actually can help like generate the RNS, the reactive oxygen species or reactive nitrogen species, and can induce the immunogenic cell deaths, and it can work together with the antibody to boost the efficacy. And beside the cells, the microneedle array patch, we are also interested in using this kind of easily injected hydrogels or like a sprayable hydrogels, and the drug can load into this kind of hydrogels. They can be formed associated with, let's say, the cavity associated with the surgery, and after surgery, the drug can be gradually released from the such hydrogels, and through such local delivery approach, the systemic toxicity can be also reduced. And the second to last slide, and so here I just want to make a very brief summary. We can do many things regarding the bioresponsible drug delivery, also bioinspired drug delivery. I put the 3 pictures here. The first picture actually is like an X-ray diffraction of the DNA. So this happens actually like that's within 70 years. Okay, and the second picture is like the structure of the virus, and this one actually happens within like 60 to also 70 years, based on the invention of the TEM, the transmission electronic microscope. And the third picture is like the first picture of the black hole. And so that means our understanding associated our ourselves, associated with nature, associated with the universe, actually still like quite superficial. So that means we can do many things, especially for drug deliveries, for the bio-inspired drug delivery. We can do many things learning, from nature. So I always encourage my students enjoy fun and make an impact. So with that, I would like to thank my students again and the wonderful collaborators, terrific support from the funding sources, especially the American Diabetes Association, the NCI, NIDDK, and also NSF Sloan Foundation. So thank you so much.
Thank you, Zhen Gu. That was wonderful, absolutely wonderful. It's yeah, I'm not sure what the etiquette here in terms of questions for speakers at these awards, but yeah, I thought that was, and I know you've done huge amounts of research to just choose what to say in 20 minutes must have been very difficult, but superb examples of glycan biotechnology, which Professor Franks would have approved, and some of the best pictures or drawings of mice and mini pigs I've seen as well. And they also detected, they looked like Rosalind Franklin's famous slide 51 of DNA on the last slide that you showed. I'm not sure what that was, but it looked suspiciously like that. Does anyone? I mean, we can allow one or two general questions if anyone wants to ask a question of Ken based on that presentation. Anybody or a comment? No, I don't think that's I think that's okay. So many thanks indeed for that presentation.
Okay, so now we'd like Dr. Harding to give closing remarks, please.
Right. So it's a great honor for me to close this is the inaugural award, the first year of the Felix Franks Award, and I think everyone's been very impressed with and has achieved. And for a early career scientist, what you've done is absolutely amazing, really, and a good example for other early career and young scientists to follow, to show just what can be achieved by hard work and enterprise. So absolutely, the Royal Society of Chemistry is very proud of giving this award to you, and it just remains for me to thank the Vice Chancellor, Professor Zhen Gu, and also Professor Gao, the Vice Dean, and in fact everyone at Zhejiang University for hosting this event. One is always a bit nervous about these online things, and during the presentation, a little square appeared saying that poor quality internet connection. So I'm just thinking maybe that was Felix that sent that down to us, but fortunately nothing happened, and everything seemed to continue okay. So yes, so thanks very much everybody for hosting this this very successful occasion. Before Professor Gao gives the final closing remarks, I want to just hand over to Suzanne Franks, who I'm sure would like to say a few words on behalf of the Franks family. Suzanne, can I hand over to you?
thank you very much indeed, Steve. That's most kind of you. And I wanted to add, really, on behalf of Felix's family, my sister and I are both on this call, as you know, to say how very delighted we are that this medal has gone ahead, despite all the difficulties, obviously, this year with managing things because of the COVID issues. We're absolutely delighted to have been able to participate in this. Thank you very much to the university and Vice Chancellor and Vice Dean, and congratulations to Professor Gu on a great achievement. And it was fascinating to listen to your work and to look at the exciting innovations in drug delivery that you described. And I must say your slides were absolutely excellent. I'm also a university professor myself, and I was very, very impressed with the way that you designed the slides, and particularly I think we've got a lot to learn from that. And then finally, I'd like to thank also Professor Harding and the Royal Society of Chemistry for making this award possible for the organising, and for those who are on the award committee as well, because I think they had quite a difficult job. I think there were a lot of good entries, and Professor Gu won it in a strong field. So thank you very much to all of you, and greetings from London. And we were delighted to be able to join with Hangzhou for this occasion.
So can we take a picture together so we can stand up and take a picture with the screen?
Good. 看一下我靠背放的好。好，
我只拿一个这个牌子啊，拿一个这个 medal 的，然后是吧？对。然后信号也可以拿，要不然手热起来。
So everyone look at your camera. So we will take a photo with all the people online and with Professor Gu, Cho, and Gao. So again, I will send you the photos later.
Thanks. If everybody could show their cameras if they can, so we would get us all on the screen. Don't be shy. Imo, Tony.
1, 2, 3, smile. 1, 2, 3, go, smile.
Okay, so that's it now, and thank you everybody in Kaohsiung for staying up so late. I'm sorry we chose a time which was in the evening, but it seems to have worked okay. I think everyone seems to have enjoyed it, and kind of wish you, like Suzanne said, I wish you all the very best for 2021, and I think it's going to be a much better year this year than it was last year. As you can see, we are still locked down in the United Kingdom. Very much, it's not easy to go into laboratories and things, but that will hopefully change very soon. And this is a great start to the new year with the Felix Franks Award for 2019 finally done. So well done, everybody, and hopefully we'll see you again soon. Goodbye. Yeah, we've recorded this, by the way. If anyone's got any objections to the recording, let me know. But if we're happy with this, we'll do some editing and we'll put it on the Royal Society of Chemistry site. So it's there forever for everybody to enjoy. Okay. Bye. Bye, everybody. Thank you.
Bye.
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 Bye. Take care.
Bye.
Bye. 非常好，非常好，祝贺。
Thank you, Steve. Thank
Okay,
you, Steve.
thanks,
That was
Suzanne.
great.
That's kind. It worked, didn't it? Yeah.
Yeah, it's just about.